My name is Sherry Allen. I am the Level 2 Respiratory Clinical Educator, and today I would like to give you an introduction to the nasal CPAP bubble device. We're going to look at our equipment. We are going to look at setup, troubleshooting, and the nurse's role in maintaining our bubble CPAP. First, let's begin with our interface, which is the RAM cannula. You may have seen this. It can be utilized with the heated high flow cannula as well. With the bubble CPAP, we are trying to achieve an 80 to 100% occlusion of the nares. With that, we want to inspect the nares every 4 hours for blanching and skin breakdown. Next, you can see the RAM cannula connects at the Y of the circuit. Next, we have a pressure monitoring device hookup, which leads back to our actual bubble CPAP pole. At the top, our blue device is an oxygen analyzer. This is a reliable source to monitor our FiO2. It's plugged directly into our bubble CPAP system at the manifold at the heater. Next, we have a pressure manometer readout. This is actually from our source by the patient Y. This has a plus minus 2-point variance. So we think of this more as a low pressure alarm. Don't get too hung up on the readings, and we'll actually go by our set dial. Next, we'll go to the source of the bubbling, and this is the actual bubble CPAP chamber. This is filled with water by your respiratory therapist to an appropriate level, and this is where the actual CPAP level is set. The prescribed level by the doctor will be set by your respiratory therapist, and if there are any changes, please call your RT to change the level. So the set number right outside the bubble CPAP chamber is the actual reading. So currently we have a bubble CPAP reading of 6. If our doctor should reduce our rate, your RT will make the change and set to 5. If the prescribed level is 7, we insert the CPAP probe to 7 just being exposed. This should only be done by your respiratory therapist, and please call if you have any changes or discrepancies. Next, we'll go to the source of our gas, which is our oxygen flow meter off of the blender. This is set on initial setup by your respiratory therapist, and we use a range of 7 to 9 liters per minute. This will not be changed. This is a stable setting. What we do change and alter is our blended FiO2. So right now we're at 21%. If we need to make an adjustment, it's all made at the blender. The change at the flow meter does not change our actual FiO2 on the patient. It's just the flow to generate the bubble of the CPAP device. So as for the nursing role, we ask that you only let your RTs set up the bubble CPAP per policy. The nurse may make adjustments on the blender for FiO2 as needed. And call for your RT for any other changes. As for troubleshooting, we always want to hear the bubbling. Our chambers should be rapidly bubbling at all times. This gives an oscillation effect in the bubble CPAP, which is beneficial to the patient. If we lose our bubbling, this is a time that you can begin troubleshooting or calling your respiratory therapist. And as you can hear, we're starting to get a low pressure alarm. And we have our lack of bubbling in the chamber. The best procedure for troubleshooting when this happens is going to the patient to begin, checking for prong insertion in the nose, making sure the baby didn't pull the cannula out, making sure we didn't have any pieces break apart, which happens, and working our way back through our circuit to the chamber and to the heater chamber. If you cannot immediately find a fix, like I said, please call your respiratory therapist immediately. Thank you very much. That concludes the demonstration.